Okay, let's go. Mike, I'm one management consultant. I think Chris, you had a background you could see from the image that I've got on the screen a little bit, but my sort of like background in regards to the entertainment industry as a redcoat. Um, I remember being interviewed probably about 8, 10 years ago by a broadcaster at BBC Radio Sheffield. Said, what transferable skills did you learn as a Butlins redcoat in regards to what you do sort of like now? And it's quite a lot, more of a lot, and that's helped me more than probably a lot of the professional training course that I've done. Probably starting off with my two daughters that you can see on screen. In the early years of their life, suffered with um, mental health. Um, Prior to setting up my business, I spent many years in the corporate sector, um, doing talks, around the country and also internationally. And most recently, probably a couple of years ago, co-published a book on confidence habits and how to, and keep it. And also MHFA England instructor, that's mental health first aid England instructor, go around the country, online and in person, helping organisations who care about their people, teach them about, mental health and well-being. So it's on the increase at the moment in time. We probably hear it's quite a lot in regards to mental health, people being burnt out, a lot of challenges that we all face in business, which is also being mirrored in life. Um, there's two types of businesses: businesses and organisations that care, and some that just want to, it's just a tick box. They want me just to come along there, just to tick that box because they might want to access, um, very London, and it's happening more and more. People call that greenwashing. What we also do when I go into organisations and those who care about their people sometimes end up supporting those business leaders, especially from sort of like burnout, and also training them on how to help their managers and all themselves around their own sort of like mental health and everything. Because they're touched on NHS Trust, a lot of work with NHS, local authorities, corporate teams, charities like Shelter. I did a lot of work recently with the Volatraction Sheffield, which is a local, which was in Sheffield, and we were able to get a lot of funding from the government to support a lot of the local charities around their own sort of like mental health and well-being, so that because they're on the front line helping and supporting people, but then it was a case of how do they look after themselves, and that's where I came, that came in. And as I said, as I started, and what makes a difference is my own sort of like lived experience. Also supporting, my two daughters, especially my younger daughter who was diagnosed with ADHD, dyspraxia, and dyslexia many years ago. It was a challenge. One, getting the information, understand actually what it was and actually how it can help. What I didn't realize at the time is that prior to setting up my business and working with organizations, I was able to spot the signs and symptoms of mental health, and I'll come on to that in a moment, um, in the people I was managing. Because normally, a lot of times when people do suffer with mental health within organizations, they don't necessarily put their hand up or say anything. Um, and so and so those insights gave me the skills and knowledge and tools to be able to help those people there as well. I also was diagnosed with a rare brain tumor. It's a pituitary apoplexy, which means that in our part of the limbic system, we've got pituitary glands just below the hypothalamus, and that produces a lot of our the hormones that the body needs. And I had a tumor in there, and which was successfully removed. Fortunately for me, it was benign. But at the time, I was in hospital for 7 weeks, and I couldn't work for about 6 months. And so that really tested my mental health and well-being. I knew where to go, knew who to turn, I knew where to get the help and support. A lot of people don't. We know the NHS is, when it comes to mental health, it's not the best, but they are improving. Going to the GP, yes, they're going to give you tablets and try to give you access to, counseling or CBT or something else, but it's not always available. It all depends on where you actually live. Going back to this term, the mental health, um, if we're all honest, a lot of people will ask me, what is it and what is it that you do? And we'll say, we'll hear the word a lot of the times, but don't necessarily know what it actually means. But in a nutshell, you've got mental health. We all suffer with mental health. We've got mental health, poor mental health, you know. And if I was to summarize that, it's how we think, behave, and feel. Or mental health is when we start to impact on how we think, feel, and behave. So work, um, suffering with stress, depression, anxiety. We may not be diagnosed at that stage, but we're feeling run down, we're feeling stressed. We're not able to have conversations or struggling with conversations with people around us, friends and family. And the day-to-day task that we would normally do becomes a little bit onerous. And then that mental ill health is where it's been going on for a longer period of time. Depression, PTSD, anxiety, suicidal ideation, drink. But again, we might not necessarily have been, and I say might, in a high percentage of the time, we haven't been to see a GP or healthcare profession because either through stigma, we just say, we'll just suck it up, just crack on and get on with it. We still have quite a lot, you know, and so therefore it's only when somebody points out or we burn and crash. At that point, we're then in crisis, and then we end up in A&E. And this is happening more and more. And the cost of that to business, the human cost is huge, and the business cost is quite significant. Kristen, and you touched on there about sort of like the training, mediation, managers not being trained and senior managers not being trained. It's the same in mental health. Many years ago, I went to university and learned about management and everything. Now, and go into organisations, there's very few managers are actually trained. When you think level one managers are trained in mental health, and when you speak to people in recruitment agency, and a friend of mine in that as well, it highlights that all that the workforce now, the people looking for jobs, they're more likely to seek organizations who, one, the managers are trained to support mental health, and companies that demonstrate that they care about their people, and that's becoming more and more significant. On the left-hand side, you can see there the human cost is quite significant and quite huge, as well. And people ask me, is that because of COVID and these numbers have increased because of COVID? It was there before COVID. It has been for a long period, of time. We've got some legal people here. And so it's only pertinent that we talk about the legal context as well. You see physical, most people are familiar with physical first aid. And when we talk about the 74 Act, that organisation that employ more than 5 people must have somebody trained, or a number of people trained. We're not quite there yet with mental health, with mental health first aid, but they've still got a duty of care under the 74 Act, Equality Act. But the key thing is about these reasonable adjustments overall. And where many organisations fall down is because it's not necessarily in law as yet. They feel as though that we don't need to do anything. But litigation is on the increase. And I was reading recently in preparation for this that there was 170, a a technician was awarded £117,000. He had arthritis, depression, anxiety. He was unfairly dismissed with no adequate support. And there was a public sector director who was dismissed during the probation period. A tribunal cited discrimination that was linked to ADHD and PTSD, and the payout was 4.5 million. Okay. So it is a big concern, growing concern. So a couple of things to consider, because a lot of times when I meet people, I hear this, Mike, we need more people like you. We need more people like you. Or, it's a case that I'm fine. My friend could really use this because we've got lots of negative thoughts. We have in the region of something like 80,000 negative thoughts a day. And they're not going to go away, you know. We hear, I wish I had someone like you 10 years ago. It's nice to hear this now, Mike, but it's constant, it's all the time. Um, you know, um, it's not just the training, go in there, or the 2 days training, or the work that we do with them. It's something that you have to commit to over a long period of time, because it doesn't know again. So I say to people, oh, well, let's start now. Why not you too? Because a lot of times I'm fine, but my friend could use it. But a lot of times it's a barrier for them to accessing help and support. So rather than, 10 years ago, how about now? Let's move forward with that help and support now. So in terms of that support, feel free, to connect me with organizations, who really care. Or you might be feeling that they're in an organization which is quite stressful, need that help and support. People ask, is there any specific industries, but we all suffer with mental health and well-being, but the more stressed ones tends to be around charities. Chris mentioned this NHS, which is major, and I've done a lot of work with the NHS. I've worked with MPs and Premier League footballers. Inspire me to speak at various events. Let's collaborate, help to share, my story, overall. Um, because that's where a lot of the juice comes in. I don't just deliver the training, which it's more engaging, more interactive. But where I come from is my own lived experience, and I pull that into the training and make it, real for everybody. So here's my details. Feel free to connect with me on LinkedIn. Hopefully, I'll drop them in the chat. There as well. Just keen to talk to people within the group. And feel free, and also connect me with people within your network to keep this conversation moving along. Okay, so that brings me to the end of my little bit about myself. Time for any questions?
Mike, I've got a quick question. It's more about who I can connect you with, and if you're already connected with them. So just looking on the LinkedIn, obviously your tagline is helping women in leadership. Are you connected with any men's mental health things as well? In particular, have you come across Wingmen?
No, I haven't heard of that.
Okay, so
Yeah.
Wingmen is a men's listening service that will then signpost people to people like yourself. So it's for men for discussing anything without judgment in a safe environment where someone can just listen. And then they work with Andy's Man Club and mental health advisors and people like that. So if you'd like, I'll introduce you to Ali, who's in charge of linking all the JVs and everything like that.
No, that'd be brilliant. Thank you, Ron.
Excellent.
Mike, I just wanted to ask, what size of organisations do you work with? Do you have a minimum amount of employees, etc.?
Great question. When it comes to the mental health first aid, for example, that's online and in person. The maximum for that is 16. When I deliver sort of like webinars, online that can be up to run webinars for say 100 and had one the other day with NHS South Yorkshire. It was about 145 that was signed up on there. Okay.